Okay, what about salt? Preoperatively, people without the mini-gastric bypass in the United States eat much more salt than we should. So that we know from lots of experience that we're eating more salt. Because salt is something that improves the taste of food, so the food companies know that, and everything that you eat is full of extra salt because it makes it more tasty. What the consequence of all this extra salt is that the salt is an active ion. The sodium in salt dissolves into sodium and chloride, and the sodium is actively managed by your body, punching it 90% of the time into the blood. So if you eat salt, the salt moves into the blood and pulls water with it by osmosis, causing your blood volume and blood pressure to go up. So that's good. And so that's why they put salt in Gatorade. If you're going to play a football game, you want to avoid dehydration, we give you some water and salt that moves the water and salt into the bloodstream and resuscitates somebody who has dehydration. Okay. But overtaking the input of salt begins to derange the body's natural hormonal balances. So instead of keeping a perfect balance in salt and keeping a perfect balance in blood pressure, a perfect balance in fluid, and a perfect balance in the kidneys, where all this is managed, things go rotten. And you start to get high blood pressure, and you start to get fluid retention, and all the other physiologic changes that go along with obesity. So if you're not going to have the mini-gastric bypass, you need to very aggressively avoid salt in our culture because our culture is so over-salted. Now, once we have the surgery, the mini-gastric bypass causes a massive change in the hormones inside your body. It causes what we call a massive diuresis, or a bunch of fluid comes out of your kidneys, or another way to say it is you pee your brains out. In fact, it's so powerful, the surgery itself is so powerful, that it'll cause a salt loss so severe that you'll become dehydrated, weak, and tired. And so instead of having an enjoyable recovery, you'll have a recovery which is filled with kind of tiredness and weakness and a lack of enjoyment. This morning we saw two people from last week, both of whom had been out. They had been here and been there and just enjoyed themselves. That is a sign that they were getting enough salt. If you're weak and tired and washed out, most of the time we find in our post-op patients that can be solved with some extra salt. So we encourage you to eat lots of additional salt during the first week post-op, and then some additional salt for the rest of your life afterwards, because of the power of the therapy that we use. That's the mini-gastric bypass. It is such a powerful impact on the salt-retaining hormones that it takes everything you know about salt and turns it on its head. So for example, for the rest of your life, you can turn to that piece of chicken or pasta, whatever, and empty the salt shaker on it. Whereas your wife is going to be going...
Does it matter between iodized and sea salt?
No, it doesn't make any difference.
Gatorade is coming out with a new reduced sugar diet Gatorade. Is there any value in that for our purposes?
Well, it's not a bad thing, but people get confused, and I'd like to maybe stop and do another video on diet foods and low sugar and